When we talk about attention deficit disorder, normally the conversation revolves around our children. But when it affects adults, man, does it affect adults. And Dr. Jorge Porras is here today to talk to us about that from eStudy site. Again, am I wrong in saying that normally we associate attention deficit disorder or attention deficit hyperactivity disorder with children?
We do, and oftentimes they are treated. The question is what happens when they become adults. And there are many adults, when they become adults, who kind of, quote, grow out of it. But many do not and go undiagnosed for years and years. And in adults, it's a little different than children. Children, when they come to your office, you know, they're running around the chairs, they're jumping off your couch. You kind of know you're hyper. But adults, a little different. You know, if you have them sit in a chair, you ask them, do you feel like you have some inner restlessness? And they'll often respond yes. They're able to kind of control themselves, but it's really hard. And then when you ask about other things in their lives, it's hard to control their distractibility when they're at work. They feel they need to walk around. And many times they get jobs where they have to be on the go.
Right.
And they're multitaskers and everybody loves them. But we know that some of them may have ADHD as adults when we hear their spouses saying, you know, we can't even take a break at night. We have to be watching something. We have to be doing something. And that sometimes is where the problem comes in.
Well, and as adults, I think people kind of tend to misunderstand them, just like we misunderstand the behavior in children sometimes. Other adults might find the behavior annoying.
Right. And that's true. What we'll find is the spouses or friends or colleagues will say they're great to be around, except they get moody. Many times they'll find that their self-esteem is low because their whole lives they've been you know, you have to tell them 2 or 3 times, are you listening? Did you hear what I said? Did you do what I said? They have difficulty following through. And so for various reasons, sometimes they'll lose friends, they'll lose spouses, they'll lose jobs, and that's why it is a disorder rather than just having a little bit of an attentional problem.
Now, is the treatment the same basically as it is for kids?
It is. The difference is that the same medications that we use are a little bit longer lasting because whereas a child needs to be very attentive at school and then school's out and they come home, the adult has to not only be at work, but when they get home, they still need to have that focus for their family. And so the medications are similar, but they're a little bit longer lasting.
And how are we doing on the medications? New advances?
There are new advances. The same stimulants that we use in all these treatments, we're doing some studies ourselves, and we're finding some good results with it.
Now, when you mention studies, I don't want to leave without mentioning that. Is this a good thing for clinical trials?
Right. One of the ways that you can really approach this is to see your own family doctor first. And if you have a child that has ADHD, you might have a look at yourself as maybe having some of those problems, and you can be referred to a specialist. Another source would be to look at our site and yours and look into maybe getting into a clinical trial.
So if you want more information on that, estudysite.com.
That's right.
Very easy. Okay, Dr. Porras, absolutely fascinating. Great to see you.
Thank you.